Okay. Good afternoon. I'm going to call the August 18th monthly meeting of the Board of Health for the City of Ashtabula to order. Chris, could you please do the roll?
Absolutely. Jim Timonier,
Here.
David DeGeorge, Maria Fowler,
Here.
Terrence Guerrero, Christine Seifert, Ruth Simon.
Here.
Let the record show Ruth Simon is here virtually as FaceTime due to constraints she has of needing to stay home.
Okay. And just also for the record, our bylaws do state that 2 is a quorum.
2 is a quorum, and our bylaws also allow for virtual attendance.
So we do.
Staff present, Christine Hill, I'm here. Terry Collette is here.
Okay, great. We will start with a motion to approve the minutes from our last meeting. And a motion by Maria, a second by Chris. Any further discussion? All in favor?
Aye.
Any opposed?
Aye.
Motion carried. Okay. Environmental health report. We probably have to turn on the mic there.
Hello. Okay, you should have your July or August report for the EH department, going over July's activities. The first page is the inspections conducted for the month.
Terry, I have a question. Where's Spectrum Academy Daycare? Is that a new daycare?
Yes, it is. It's on West 30th. It formerly was a building, I want to say it was Job and Family Services before, by Roto-Rooter.
Yes, okay.
Okay, so they are not doing food there at their daycare. The children are going to bring in their lunches. So she needed an exemption form completed, that she's not having a food service license.
Thanks.
You're welcome.
Any other questions on the inspections?
We had the Ohio Department of Agriculture here last month for survey. They were here for 4 days, reviewing all the retail food establishments here in the city, and conducted 2 inspections together.
I just want to say a word about that. So, you know, those are like 2 short sentences that don't quite describe what that's like. So when the Department of Ag comes in, it's pretty, you know, we have a lot of oversight in the health department. And, you know, Department of Ag survey is one of the pieces of oversight that we have. Terry worked very hard to prepare for her survey and to, you know, host the Department of Agriculture when they were here. They did have somebody in training, so it was an extra long survey because there was a lot of explaining and examples being, you know, presented for the new person. And Terry was very professional through it all. And I really want to thank her for her hard work. We just recently, we did have an exit interview when they left. Terry's found to be in compliance, our department's in compliance. They do have some, what do they call that, action plans?
Action plan, yeah.
Some action plan items. They rarely leave here without, you know, suggesting some action plan items. So we will turn those into them. They're things that are very doable. But, you know, it's always, you know, nice to hear that you're doing exactly what they want you to do, so.
Thank you.
Okay, any questions on the nuisances?
An environmental assessment.
So that was, a lot of times, companies will ask me for an assessment on the property if that particular location, if I have any complaints of, or knowledge of underground storage tanks, wells, above-ground storage tanks, chemical spills, all those array, you know, the assortment array, and then I have to respond with, most of the time I don't have anything. In fact, that particular address, I didn't have anything either. But I have to go and verify the property that they're looking at, double check at the site, make sure it is clean, there's nothing, I have nothing in my records, and then I respond back with a letter to them.
Okay. Anything else for environmental health? I will entertain a motion to accept the report.
Second.
Motion by Chris, second by Maria. Any further discussion? All in favor?
Aye.
Aye. Any
Aye.
opposed? Motion carried. Okay,
Thank you.
thank you. All right, are you doing the nursing director report?
Yes.
Okay.
Both the nursing directors are off today, so I'm going to present their report for them. So in your packet, you will see the nurses' report for July of 2021. Highlights from their report. You can see the COVID vaccine that was given in the month of July. Janssen, Moderna, and Pfizer. We have given through the end of July, and now we've done more, of course, because it's August, but 6,015 vaccinations in all three brands of vaccination. We have begun to give a lot more Pfizer. We've been working with the county health department because Pfizer comes from the state in such a large amount that we have agreed, the three health departments in this county, that it'll come to the county health department in Jefferson, and we will all take portions. And that helps the county out because there's no way they could possibly go through that portion and the amount of time before it expires. So we all just sort of share in that Pfizer. And of course, the Pfizer being used so much here, we've really been focusing with back to school, trying to get these kids age 12, and school-age kids vaccinated, and of course their families. So we have started giving a lot more Pfizer. Communicable disease report is before you. In July, we were fairly quiet for COVID. We only had 18 cases, but that is no longer the case. We are very, very busy with COVID cases now. It feels very much like it did at this time last year. It saddens me to say that. The Delta variant and the unvaccinated folks, and even some of the vaccinated folks that are at risk for the still getting sick, we are seeing a lot of cases, and I wish I could have better news for you. But in July, we had 18 COVID, 1 Lyme disease, 1 rabies animal submitted that was not a case, 1 hepatitis B, 1 varicella that was not a case, 7 gonococcal, and 7 chlamydia reports. Other highlights from their programs and meetings. We had our second vaccination clinic. It was a large community clinic. We held it at the mall. It was a collaboration between UH, ACMC, and the health departments of Ashtabula County. We called it How Sweet It Is to Be Vaccinated, because we were giving away Dairy Queen coupons for treats, and people really enjoyed that. They got a kick out of that. So we did, the demand for vaccine has really lowered, and I think at that clinic we did about 50 people, and the majority were first doses, so that was a very successful clinic. We've also continued to do clinics, out and about in the community. We're doing closed clinics at employers. MFG is one that's on here. We've been going to Carrington Park. We've been going, wherever we're invited, we'll go. We've been holding public clinics as drive-through clinics, as walk-in clinics in our department, just any way we can. Here in August, we've been at quite a few back-to-school events to have a presence there and try to vaccinate the families and the kids. We did go to the Ashtabula Area City Schools DEC-sponsored Family Fun Fest. We did COVID-19 vaccines, we did blood pressures, we did education, we talked about Rethink Your Drink, tobacco cessation, and oral hygiene. So we were there at that event, and it was a nice day, and we gave away a lot of what we call swag. We had toothbrushes, toothpaste, water bottles, flash drives. We had a lot of swag, and so people were stopping at our table, and it was nice. The other thing that I wanted to highlight on their programs and meetings, on July 28th, to Terry and Peggy went down to the county health department. I had met with Peggy beforehand to prepare for this meeting, but it was one of, I think, one of several meetings that we're going to have. We have to write up an after-action review. AAR stands for After Action Review, and we are reviewing our response to COVID as a county. What were our strengths, what were our weaknesses, could we improve upon, and it ties back into the FEP grant, the preparedness grant. There's capabilities that we have to demonstrate, and so all of that's being written up, and we're working on that right now. I did also want to share with you in your packet, you'll see some survey information. We did survey people that came to our second dose clinics just to get an idea how things were going. The first form is the survey totals in general. And you'll see the questions are, is the location of the clinic convenient and accessible? The vast majority of people like the location. 537 said yes. We did have a few that said no, that wasn't convenient and accessible. And you can read down through. We ask anything about how did you hear about the clinic? This helps us make decisions about how we're going to advertise clinics. The vast majority of people got the information from the websites. The ODH website, the City Health Department's website. Some got word of mouth from family. Some saw it on Facebook. Some heard it from a friend. Very few people from the newspaper. And so just a variety. And then we asked them how they registered, how far did they have to travel. The vast majority of people were local. Was the service timely? What type of vaccine did you receive? And in the future, what would be the most convenient way to come and get a vaccination? What type of clinic would they like to see? So all of that helps inform some of the decisions we make. And then the second page of the survey, it's broken down by location. So when we had the location at the City Health Department, when we had the locations at Kent, when we had locations at the Ashtabula area city schools, and when we had clinics at the People's Baptist Church. So you can look at that for yourself. I do think that all of those locations for the vast majority of people worked out well and were accessible and people were comfortable there. I think that's just about the end of my report. I just want to let you know that there's ever-changing guidance that's changing, things that are happening with the vaccine. The latest information we have about the vaccine is that there is a very small group of people that are severely immune compromised, that they are recommending a third dose of the vaccine for those folks. And we do have a list of medical diagnoses that would fit into that category. Certainly we encourage people to talk to their doctor to see if they're one that should get that third dose. And these are third doses of the mRNA vaccines, the Pfizer and the Moderna only. The Pfizer and the Moderna only. The J&J vaccine, they are still studying it. We don't have any information about an additional dose of J&J. They do want people to understand that this is not considered, this particular recommendation is not considered a booster shot. Booster shots are for people who've had their vaccine, had the efficacy of the vaccine completely realized, and then over time, that efficacy wanes, and they need a booster. And that's not unusual for vaccinations. We have that. Tetanus is a good example of that. You get a tetanus shot, 10 years down the road, you may need a booster of that tetanus shot. This third dose that's being recommended for people immune compromised, they never reach the efficacy that vaccine could provide. They need potentially a third dose to reach that efficacy or get much closer to that efficacy. So that is the difference. They are discussing, and we are getting guidance about a completely different way of looking at it, which would be maybe a third dose for people with normal immune systems. So we're trying to find out more about that, but we don't have a lot of guidance on that just yet. We don't have a lot of guidance on that just yet, how that'll be rolled out. So just stay tuned. But for right now, it is for people severely immune compromised. And please talk to your doctor or reach out to us at the health department. We're going to put something on our website and our Facebook page that talks a little bit more about those type of conditions that might make you want to consider getting that third dose. That's all I have for the nursing division. I'm happy to take any questions from the board.
At the health department, are they allowing, so I know there was a kind of a specific list that ODH had put out about who is immune compromised. And then there was something in that language about speaking, like if a patient's physician deems them, highly at risk or immune. So is it possible that a physician could say, well, I know that it's not a cancer patient or an organ transplant recipient, but here's the situation, and they could ask the Department of Health to vaccinate them?
Yes, Maria. Well, we try to do that education with the patient, and do encourage them to talk to their doctor. And even the list that the Ohio Department of Health has put out, they state at the beginning, this is not an exhaustive list. It is, these are conditions that are included, but they're not limited to it. So we always have to refer back to that knowledge of the person's physician, and we would absolutely take that into consideration.
Would that require, though, that patient bring you some kind of a letter from the physician, or can they just come in and say, my doctor said?
Yeah, we have never required any documentation like that. So we do want them to speak to their physician, but we would not require that documentation, at least not at this time.
Okay, I will entertain a motion to accept the nursing report. Motion by Maria, second by Chris. Any further discussion? All in favor?
Aye.
Any opposed?
Aye.
Motion carried. Okay. Health Commissioners report.
Okay, so then I'm going to move on. I wanted to talk to you just very briefly about accreditation. So we are working right now with the new company, the new vendor that we've chosen. The Community Health Assessment Committee, which is a countywide committee, has chosen Illuminology. It's a company out of Columbus to perform our next CHA and CHIP. We are working with them one-on-one with them for city information. So we've been talking back and forth about a contract where they would help us get city-specific information. We have not seen that contract yet. We did get a quote of what it might entail. It's under $4,000, $3,500 and some dollars. So I'm waiting for that contract to come across my desk, and we'll get that signed and get things rolling. So I just wanted to let you know that that is sort of where we're at with those things too. If you don't have any questions about accreditation, I'll move on to the finance report. The finance expense report's before you. Yellow highlighted is the General Health Department and Nursing Division. And you can kind of look through where we're pretty much right on track for spending where we should be at. The blue highlighted is the food service. Not a whole lot to tell you about in day-to-day expenses. I do want to mention a new grant that has come across. This came to our attention very fast, and we very quickly had to turn around a very large, they called it a survey, but it basically was a work plan. This is a CDC to the state of Ohio, to Ohio Department of Health. They call it a workforce development grant. So it is money, one-time money, that is coming. It can be used over the period of 2 years, a couple months in this year, all of 22, and part of 23. And they wanted us to take a look at this money and say, how will we utilize it for workforce? So we met with Tracy, our finance director upstairs, talked about that, and we wrote up a proposal. So for that, we want to continue. I have agreed to stay on as full-time. Peggy Ducro has agreed, she's the co-nursing director, to stay on full-time. We'll continue the services of our contract nurse and pay her through this grant. And then one of the exciting things that we want to do is we want to bring on a brand new position. And that position, we had several staff meetings to discuss what that position would look like and with the money that we had, how could we utilize it? And in the end, we've decided that we're going to go for a public health support specialist type position where they would just support all of the divisions. And we will teach them a variety of clerical things and a variety of things to just support the whole department. And we think that will give us the biggest bang for the buck. So we're excited to have had that report turned in, and really just sort of waiting to hear back from the Ohio Department of Health and the CDC as to if we had to make any adjustments in that report. So I did want to let you know about that. And that is $180,000. Yeah, so a nice amount of money. They are calling it soft money because it is just really a limited amount of time it can be used. I don't know if it'll follow up with any additional funding, but we're going to utilize it. So that's all I have financially to report. I'm happy to take any questions. Okay, so I'm going to move on to COVID response report. Give you just a few statistics about COVID. Currently in the city, we're actively following 19 cases. Just really, if you look back just a couple weeks ago, we were actively following 2 and 3 cases a week. So it's ramping back up. We're getting an average of 4 to 5 new cases every day. The total positives for the city at this time, 1,531 positive cases cumulatively. We currently have 1 patient in the hospital. We've had in the city 105 people hospitalized cumulatively. Deaths are at 32. We do not have any current deaths. I will tell you that, we no longer in Ohio have the mapping system that shows the health alerts, the color-coded map, but the CDC does have a tracker. And in the CDC tracker, all of Ohio is in high transmission, high spread, except for 2 counties. We're one of the 2 counties. We are in what they call substantial spread, but it's going to be a matter of days until we're in high. We and Athens County are the 2 counties that are in substantial spread versus high. But that is significant. We know that we're having a 4th wave here, and that's just demonstrated there by that tracker that they give us. Vaccination. I wish I had a little better news for you. Vaccine started in the county of Ashtabula. 44.69% of our population that's eligible for vaccination has started. Vaccine completed, 41.75%. So obviously we've got some work to do and more folks to vaccinate. There's been a lot of uptick. Terry Collette could tell you in the environmental health division we've been getting a lot more phone calls from businesses and people planning events and just wanting guidance, wanting to understand how to keep everybody safe as we surge again. And so we've been answering those questions the best we can. One of the entities that we've worked very hard with is the school system. And we've had quite a few meetings with the schools, the superintendents, our Ashtabula area city schools in general, to talk about plans for returning to school. We made a statement along with Ashtabula County Health Department and Conneaut City Health Department, a statement recommending universal masking in the K-12 schools. And that statement is in your packet if you'd like to read it. It just is a statement that is saying that, regardless of vaccination status, universal masking would be a strategy for keeping everybody in person longer, better. That being said, understand it's a complicated issue. I do. I understand that you've got half the parents that would probably be for that and half the parents that would probably not for that. So, it is a complicated, complex issue, ever changing. We did get the COVID policies for Ashtabula area city schools for the coming year. They are going to do almost like a hybrid model where they're going to have teachers masked. And Chris, if I'm saying this wrong, let me know. They're going to have teachers masked. They're going to have students masked when they're outside the classroom. In other words, if they're in the hallway as a group and they're going to the restrooms or making their way to the cafeteria or something like that. But once they're in their classrooms and they're seated and they're at their desks and they have plexiglass barriers, they're going to allow them to take their masks off. So, this is sort of that, that maybe common ground that they found. For us in the health department, what it means is that, we will have to do contact tracing. If they had a universal all the time in classroom, every place in that school, except for, of course, when they're eating lunch, if they had the universal masking, there would not be as much contact tracing. But when they are unmasked, we have to do contact tracing if you get a child in the classroom that's positive. So we'll just, cross that bridge when we get to it. And we had great cooperation with the school nurses last year and with the administration, and we will need that again this year because, we're a very small department, and it's a lot of work when you have a child in a classroom that's positive and on a sporting team. They will be masked on the buses. That is required. So that is positive news there. So I did want to share that with you. And I think that is probably the end of my report. I'm happy to discuss anything or take any other questions.
Chris?
Yes, Ruth.
Chris?
Yes.
I do have one question, and I may have missed an opportunity to ask it earlier. On the list of meetings and activities that had happened during the past month, there was a meeting, some sort of meeting with a Sanofi vaccine rep. I just wondered what that was about.
So the Sanofi vaccine rep came in. They do have some new combined vaccines, and these are vaccines that are childhood vaccines. And she wanted to come in and talk to us about efficacy and about these vaccines. And these vaccines are part of the VFC program. Ruth, I know you're very familiar with that program. That's the state-provided vaccine for children program. So she came in and she kindly brought us some a taco lunch, and we had a lunch and learn. And she talked to us about some of their new products that the state of Ohio will be carrying.
What new vaccines are combined?
I knew you were going to ask me that. And I can't remember. Peggy or Colleen could probably better tell you. I can always email you.
Okay.
I feel like it's a meningitis and something else, but I could be wrong.
Okay.
I guess the lunch and learn. I guess maybe I need to have another lunch and learn to remember.
Okay, any other questions for the health commissioner?
I just have one, and it's about testing. When someone calls the health department or they're wondering where they can get tested, I think there's a lot of confusion about where people can go and what they need to do to get the test. So where all are you aware of right now that you could walk in and get a test? And is it 7 days a week? And do you still have to have a physician's order for it? Or are some of those places you can just walk in and there's a provider there who will order the test?
So that's a great question. And, this county, we do have a pretty robust testing network. Testing is, there's testing for people that are testing because they are symptomatic. There's testing for people who are testing because they've had a exposure.
Okay.
There's testing for people who are testing because they're well and they want to travel. There's testing for people who are well and ready to go back, maybe go to work, type thing. So there's testing for different reasons. Mm-hmm. Testing is available. ACMC's urgent care is doing testing. Route 20 Prospect Urgent Care is doing testing. all of our commercial pharmacies are doing testing. Walgreens, CVS, Rite Aid are all doing testing. Every one of these places, they would have to call to find out the specifics, whether their insurance is accepted, if they're cash paying, is there a sliding scale, is a physician's order required, is it not, that type of thing. They're all a little bit different, but there's lots of testing available.
I think there's confusion. It seems to me like I get questions about where they can go, or, you know, and I don't know that.
Well, maybe we can bring that up. We do, as a county, talk at least monthly, and maybe we can talk about that. Maybe we can do a better job kind of rounding up the testing locations and information and get it out on websites and
Even
things
if there
like
was
that.
some kind of a chart that could be put up on the website or whatever, and it would have the testing location, a
Phone
check
number.
yeah, phone number, required physician order, yes, no, hours of operation, you know,
Sure.
type of test, something, just so people could have that information, and then, you know, healthcare providers would also have access to that. If I had a copy of that in my store, I know it would be helpful just to be able to direct them or give them a copy of that.
Yeah, we can pursue that for you. Absolutely. That's
And are they still antibody testing?
who's they.
Any of these
Yeah,
entities?
I don't know that much about, you're talking about for COVID titers?
Yeah.
You know, I don't know that much. That is definitely physician order, and I don't know who does that.
And the only people I've heard that were aware of antibody levels were people who had they went to donate blood, and then they were given that information that way. But I don't know of
Yeah.
anybody who can walk in, and I'm not sure where you can go get that
Yeah,
done.
I think you can have that discussion with your physician, Chris, and have, you know, and pursue that way. Antibody testing's a little bit tricky because it's here today and gone tomorrow type thing. So, but, you know, it is available. It just would have to be through your physician.
Okay, anything else? All right, I will take a motion to accept the Health Commissioner's report.
Moved.
Motion by Maria, second by Chris. Any further discussion? All in favor? Aye.
Aye.
Any opposed?
Aye.
Motion carried. Okay, any old or new business? Okay, seeing completed the agenda, again, to all of our staff in the Health Department, thank you for all of your work and your diligence here. I know as I think city school started, so hopefully everything goes well there. And I know we're starting to see a lot of this in the kids, so you know, we're hoping so that we don't see these spikes that we have and we keep our kids in school.
I saw a
Your camping trip based on last month's weather report,
oh,
because we're always getting new information.
yeah, it's a good analogy.
Good
Yeah.
analogy, yeah. Okay, seeing that we have completed the agenda, we will stand adjourned until next month. Thank you, everyone. Be safe.
Thanks.
Thank you.
Thank you.